light's not right.
Oh, we have 5 without Linda, so yeah.
Right, we do. Yeah.
I'm
Okay.
going to start the recording.
Thank you. So I'll call the meeting to order, the December 2nd, 2020 meeting. And I will, first of all, call the roll. Mary Ann Abadi. Present. Richard Kunert.
Yeah, present.
Ed Copeland.
Present.
Danielle Angelari. Dr. Bill Gorski.
Present.
Dr. Terry Giardini.
Present.
Dr. Julie Morris.
She's entering the meeting room, as is Danielle.
Okay, very good. Thank you. Tim Neighbors. Linda Sandquist. And then our advisors, Wendy Bennett Larson.
Present, Larson Bennett. That's all right.
Bennett.
Whatever my name is.
Yeah, Wendy. And Jay Ware. Jay is, I see his name.
He's here.
Okay. Welcome to everyone. So our the next agenda item is public comment, and I do believe we had a request for public comment, correct, Jason?
Yeah, we did, Marianne, and that person has not, as far as I know, is not here yet, but let me check quickly.
Okay.
Yeah, I think she was gonna show up live instead
Yes,
of
that's what
via
Jason
Zoom.
thought.
That's okay. So the person who signed up for public comment just arrived at the building, and so she's not in the meeting room yet.
Okay.
I've been told that somebody's here. I assume it's that person.
Okay. So do you want me to proceed or should we just wait? How long would, I mean, she just needs to.
She just has to sign in.
Okay, well, we'll just wait for her.
I have a question while we're here. It's going to probably sound a little uninformed to some of you, but I wanted to understand, what does client identification, what did that actually mean in the survey?
Jay, maybe we could circle back to that when we get to the survey results, and I can give you the definition of that. We have our member of the public here who has signed up for public comment today. We'll let you introduce yourself, and you will have 3 minutes to speak. Thank you.
Okay. Hello, my name is Cristina Gloria, and I live in Rockford. I'm a psychotherapist. I've been working in the mental health field almost for 19 years. And I'm a mother of 6 and 2 dogs, married for 29 years. And I immigrated to the United States 32 years ago. And I have seen the Spanish-speaking population growing very fast. And unfortunately, mental health services and substance abuse services, Spanish, that they are bilingual, that they provide their services in their language, have not grown at the same rate. I work on DCFS, and there was a struggle to find providers. I work with Rosecrans, and believe it or not, and I worked there for 7 years, and my caseload didn't even make it the 1% of Spanish speaking, even though I requested and they cooperated with me with some staff to promote me as a Spanish, that they had a Spanish speaking mental health provider. And in those 7 years, they couldn't. And that is a concern to me, because when I was working in DCFS, a lot of preventable problems like with domestic violence, with mental health, substance abuse couldn't be prevented in removing children. And we have to send these parents who do not have resources like we do, day vacation or personal days, to Chicago, to Schaumburg for that. I've been very active in the community. And I know the needs. And today was my last day working in Dixon Correctional. Last year, I opened my private practice. Starting working 2 days in the afternoon from 5:30 to 8:30. Now, the reason that I quit my job is because there is people out there and they calling me. Now I have to work every other Saturday seeing people. And half of them, they want therapy and they don't have insurance, but they pay me every time that they come. And my fear is that when the money distribution goes out, we're gonna be left-handed out there. Again, with no service.
I'm gonna have to let you know your 3 minutes is up.
Yeah, and my suggestions are that distribute the money to those providers who are bilingual and to retain them locally, because many of them leave. Also, to encourage better pay for mental health providers. How somebody with master's degree is gonna make $17? I'd rather go to the factory. And I don't think Ms. Abate is gonna let me lie that. Still, they've been hired in Rosecrans for $17 or $18. So.
Okay, thank you. We really have to keep it to 3 minutes because that's part of the whole process for public speaking. But thank you so much, Christina, for coming in. And I do thank you for the work that you're doing in our community. It's very, very valued. Thank you so much.
You're welcome to stay and watch.
Could she leave her name and information with you, Jason?
Yeah, if you sign in,
Yeah.
we have, you can.
And I just wanted to say, Ms. Gloria is someone who's well-known in the mental health community and in the Latinx community. And I think we'll get to the results of the survey, which reflect her insights.
Absolutely. But thank you for coming in, Christina. Okay. Moving on, we have 2 action items. First of all, the meeting minutes from November 4th. I need a motion for approval.
So moved.
Second.
Second, we have a motion and a second for the meeting minutes to be approved. All those in favor say aye.
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 Opposed, same sign. Thank you. Also, we have an amendment to the wellness value statement. And Jason, did you want to just kind of summarize that again? That was as a result, the amendment was as a result of discussion.
Yes. I went back and I watched the video and captured the statement that I believe everyone agreed on, which was, we support the community support system framework because it focuses on providing an array of services that bring people from illness to health.
So we will need a motion to approve that statement.
Moved.
I'll second it.
Second, we have a motion with the second to approve the wellness statement. All those in favor? First of all, any discussion? Hearing none. All those in favor, please say aye.
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 Opposed, same sign. Okay, moving on to our discussion items. The procurement policy and Jason, I'll turn that over to the two of
Okay, basically, we've had some discussion, and Jason did some research on policies from other mental health boards. We have put together a draft. I don't know if everybody has a copy or not, but bottom line, we put together a draft of a policy so that these smaller item purchases that we've budgeted for and already have talked about as a board, that we would be able to give some type of prerogative to the board president to go ahead and approve certain things that we've budgeted for without having to bring it to the full board if it's under $30,000, and then another procedure for things that are above that per, statute and per best practices and regulations. The idea being that we don't want to have to come to a full board meeting for every individual item we have to purchase, particularly if it's just in the hundreds or some type of small thing that we've already budgeted for. So we've had some discussions about it, sort of looked at it, and feel good about the policy that that Jason has sort of drafted, but we just wanted to bring everybody up to speed that that's where we are with it right now. Jason, is there anything else?
Yeah, just to clarify, there was actually 3 different designations. There's a category, as you mentioned, Reverend Copeland, above 30,000, and then there'd be one that's between 3,000 and 30,000 that would require 3 RFPs, and then that would come to the board for discussion. And then the micro purchases of less than $3,000 would be ones that could be, if they're budgeted, that they could just be made by the board president, that determination about a vendor or something like that.
And to clarify, we're just talking about, for example, like we talked about like software, a software purchase of under 3,000, something we've already budgeted for, or a larger physical item, not services.
Right.
To the Met, correct?
Correct.
Okay.
And so I believe Reverend Copeland and I, in consultation with Dr. Gorski, did not add this as an action item because we thought it was worth seeking the opinion of our fiscal agent, the Winnebago County Health Department, who is writing the checks to ensure that this policy is congruent with their policy and procedures and would not create any issue for them to approve expenses and to issue our checks. So we see that as the next step.
And I've already made contact with them to let them know that that is our desire, to try to make things not only congruent, but make it efficient and effective and streamlined for everybody on both ends. And so we're waiting for feedback from them.
Would it be hopeful that we might be able to have this as an approval item by January, do we think? Jason, Ed, what do you think?
I would hope so.
I'm hoping so. again, we've already made the opening salvo in terms of discussions, and they know that that's our desire. So I don't see any reason why we shouldn't be able to.
Right.
Yeah, and I think more than anything right now, we just want to make sure that because they are our fiscal agent, they write the checks, that everything runs as smoothly as possible for the RFPs. You know, when the awards are paid out, that has to be done timely, because a lot of the organizations applying may not be able to have startup, you know, available to them. And so I think, you know, we just wanted to ensure that we're in alignment with, you know, their fiscal policies. So is important. Jason, I'm just observing Christina, have a seat. Is she standing in the back there?
Oh, no,
No,
she's
I'm
sitting.
sitting.
No, we have seats back there. So.
Oh, okay. I thought she was standing. I was like, oh no, she doesn't.
I look tall, that's nice.
Yeah.
Okay, all right. So any further discussion would be handled then at our next board meeting, and hopefully we'd be able to have it as an action item. That's
Yes,
our goal, correct?
Yes, ma'am.
All right, thank you so much. Moving on to the notice of funding opportunity, and I'm going to turn this over to Linda and Jason offer a summary to us.
And I think we're going to let Jason talk about it.
Okay, very good. So essentially, this was also done after some research and looking at what some other mental health boards are using for their notices. And so it's pretty basic up front. There's a description of what we're looking to fund, the amount that will be available, the maximum amount, the general funding categories, so types of things that might be funded, but not super specific at this point, because it does essentially dictate that we are funding what is laid out in the strategic plan, and that there needs to be alignment with the strategic plan. There's maybe a moment for discussion on who may apply, and looking at what other mental health boards fund in terms of types of organizations. There generally is an openness to funding nonprofit corporations, which we may want to note after some discussion with Dr. Gorski about how hospitals and federally qualified health centers register it. We think that they do register as 501c3s, but that may be worth spelling that out, they're included in that particular designation. For-profit businesses, which may include licensed and insured sole proprietorships and LLC companies. So that would include individuals who are functioning and operating a business as a private practice, essentially, in addition to larger for-profit businesses. And government entities and departments government entities inclusive of departments within the Winnebago County government. Before I move on, I don't know if that section warrants any discussion.
Yeah, Jason, I can fill in a little bit on our discussion. So I reached out to a lawyer, legal friend of mine from Swedes days, and Swedes is organized, even the health system itself, as a 501c3. This person, as those of you on this call with legal backgrounds know far better than I do, there's other 501 type designations. He is not sure about Mercy or OSF, and he does believe that Crusader, for instance, and FQHCs are generally organized under a 501c3 designation. Jason and I had a little bit of conversation about do we leave it as is, or do we actually need to spell out in who may apply, say, local hospital systems and FQHCs? So I think we think it's probably inclusive, that first bullet point. I personally don't know that with 100% certainty, but we think it is.
I don't think there's any problem with spelling it out more explicitly. It's not going to cause additional problems. It might prevent problems.
I agree.
I agree, Wendy. Yeah.
I agree too, because I'm on the other side. I think it doesn't include what we think it includes. I could be wrong about that, but if we spell it out, there's no debate about it.
Right.
I agree.
And also, can we switch over to the like LLCs, or do we have, I don't know if I missed it, do we include like sole proprietorships?
Yeah.
So
That is included, Wendy.
is it? Okay. Just
Yeah.
want to make sure.
Loaded
But-
and spelled out as being included.
Right, but I think that's a good idea. I think we could certainly just put another bullet item that says, what, local hospitals and community health centers?
I'm assuming Rosecrans is a 501c3.
Definitely.
What if we put as the clarification under nonprofit corporations, 501c3s, nonprofit hospital and health systems, and FQHCs, federally qualified healthcare centers, health centers.
Well, so let me ask a different question. What if, let's say, Patriots Gateway wanted to apply for some sort of counseling program?
They're
Where do they-
501c. They're
Would they,
501c3.
okay, all right. I just want to, okay.
Yeah, when Jason and I were talking about this, I think, in fact, I'm sure that probably all of the nonprofit organizations that we're talking about are 501c3s. When we were talking about it, we had the question about what tax code actually protects or defines the hospitals. And so I, of course, Googled it and found like a 501c9 and things like that, which is why we went to Bill. But I definitely agree that if we don't specifically say hospitals, we're going to have hospitals call and ask if they can do that. And we're going to have Crusader call and ask if we can do that. So we should put that in there.
And then again, you know, that's definitely can apply. I also, there's so much more defining criteria system. I mean, all of that is, you know, that keeps getting down to helping us make decisions, but nevertheless, yeah.
Right. And the other thing I just want to point out that Jason and I discussed was that you'll see under there, it says the entity be established for at least 3 years prior to applying for funding. So Jason, I don't know. I know that we had talked about that. Do we want to clarify it a little bit though, where it's that you have to have your 501c3 for at least 3 years?
Yeah, so that designation was added to both the nonprofit corporations and the for-profit businesses. And the idea would be that you would have, you know, the verification of that would be having some type of tax record that goes back 3 years.
Mm-hmm.
And the reason for that would be to disincentivize, you know, individuals or groups forming new corporations for the sole purpose of applying for mental health funding that maybe don't have any other types of legitimacy or history or funding sources.
Yeah, do we think that that sentence is clear enough though? Because my concern would be, what if I have been established for 4 years, but just got my 501c3 last year?
I understand, yeah. Probably we could add some clarification about how that will, you know.
Could you just say, or 3 years or equivalent history or something, or equivalent?
No, I think we want them to have those designations for 3 years.
Absolutely, yeah.
You have to have your 501c3 for 3 years, or I'm assuming your LLC for 3 years.
The way I'm reading it right now, am I even on? The way I'm reading it right now is it says must be registered as a nonprofit and established as a section. And the explanatory asterisk is be established for at least 3 years prior to applying.
Gotcha. Okay, and I missed the asterisk, so.
That clarifies it.
Yep, I think it does.
I have a question along those lines. Just, I think this covers it, but I'm just wondering how we deal with it. What if like a collaboration of groups or a consortium, say if 3 different entities come together and want to apply for something where they're working together jointly. To your point, say Patriots Gateway gets together with, Swedes, and they're getting together with another organization that's doing something, and 2 out of the 3 have their 501c3 and been established for a while, but maybe the third entity doesn't. Does that make a difference? I don't see that it would, but I'm asking in case something.
Well, if they're going to get direct funding, yes, it would make a difference.
Even if they're,
in my opinion.
Even if say, okay.
Well, I would say, I think the lead agency would certainly need to meet this criteria. The question would be if, let's say that part of the program required the painting of a recovery room, and that particular organization wanted to hire a handyman painter that didn't meet the criteria of one of these designations. Are we dictating that none of the funds can be, flow to any entity that don't meet this? I think we're trying to maybe dictate that the lead agency meet this criteria.
Right, but my point is that if in fact that you had 3 distinct agencies applying for funding and they're collaborating and they're all equal, I'm not just talking about hiring a painter or doing something like that from the lead agency, but I'm talking about the how many years that they have the funding. I would assume they all have to meet the same criteria.
Marianne, what do you think if one of those agencies is acting as the fiscal agent, though? Do you see?
Yeah. We haven't established this at all. This is all things that we need to be very clear about going into this, because
right. This is why Jason and I talked for 2 hours.
That's why I'm asking the question now, because what Linda's asking is what I was asking. I'm not saying like if 3 different agencies, are working together and they're equally going to be paid. I'm talking about like if Swedes applies for something and, Patriots is going to be working with them, plus some other kind of group is going to be working under them, but Swedes is the one that's actually getting the money. Mm-hmm. Does that other group have to have a 501c3? That's what I was asking.
Right. So, and Jason and I talked about that a little bit. So in my experience at United Way and at the Community Foundation, if there is a fiscal agent that the money is flowing through, then the responsibility falls on them to make sure that this other agency is following through with what they're supposed to follow through with, regardless of whether they're a 501c3 or not.
Right.
And I think that when Jason and I talked about it, we felt comfortable that if there was a lead agency that's taking on the fiscal responsibility and they meet the criteria, that if they have a partner that does not, it doesn't matter. I would think that would also be taken into account when we review the grant.
I was going to say that would be in their proposal.
Yeah.
We would understand exactly how that is all going to flow at that point in time. Because I can see, just give another kind of example, the lead agency with the program or the targeted population, they involve the Y for exercise or whatever the case may be. Now that may be paid for through that lead agency to, allow the clients to have this wellness opportunity or whatever. So we don't want to discourage that. I understand that, but I'm talking more about applying individually. And I get it that if one is a fiscal agent, I'm much more
And I want to address like
clear
Christina
on that
Gloria
kind of arrangement then.
But think about Christina Gloria saying there aren't enough Latinx bilingual counseling programs. Would she have to show a 3-year track record, or would we look at her history in the community, even if she were trying to launch a new program? Or would we want her to partner?
That's a discussion I think we wouldn't have publicly. I mean, I think we're trying to work out the criteria here.
Right.
And not personalize that at this point in time.
Right, but I'm just thinking of somebody in that position, having an idea for a new program. How do we facilitate something like that? I think we need to think about that.
Dr. Gorski?
I just wonder, is there any wisdom? I don't want to hesitate to use the phrase wiggle room, but is there any wisdom in a statement that refers to a case-by-case evaluation of applicants that may fall outside these apparent criteria? Those probably aren't the right words, but if we want to at least portend the worst case scenario, it would be that even the fiscal agent qualifies, but we see something else in a collaborative model that we don't particularly like, where one of the partners would not. And on a case-by-case basis, I suppose you could say, well, just on the basis of the application alone, then that we would not approve it. But I guess as I'm listening to everyone, all these great comments, I'm wondering if there's any room for a statement about a case-by-case basis, or is that too loose?
Well, I think my review of that, Dick, did you have something rather than?
Well, yeah, see, I want to go with where Linda came, because if we have a stable, creditable lead agency, I think that's really what we want to put the mark on, because we need, as Bill's pointing out, we need these to be flexible because we want innovation. Right. And particularly if we want to move to, some of the minority parts of the community, at the edge of the community, we're gonna find ourselves looking at and listening to, some people who who may for the first time be connected to a sort of larger, a Crusader or a Rosecrans or some lead agency like that, that's going to give us something that we really want, and we want to be able to do it.
So are you saying, so I want to understand what you're saying, Dick. Are you saying that we would still have that lead company or that
Right.
lead organization be the one with 501c3 or whatever, and they
That's
have all the
that's right.
criteria,
Yeah,
but
Julie,
then
that's right.
Then somebody who subcontracts with them through them would not need it. I agree with that.
Correct.
Because then that's where you can bring in different organizations who may not have that stability yet, but need to start to grow.
Right.
I would agree.
To build capacity.
But to leave it more loosey-goosey and say we want to keep it open for other things, I think that just kind of opens up cans of worms that would not be
That's right.
Open.
I agree. Yeah.
Because then why would you have criteria in the first place?
Yeah.
Any other comment on this? Because this is important.
Well, I appreciate the conversation. And the only reason I brought up my question is basically what Dick was getting at, is that I think one of our values is to foster collaboration and synergy, and
I
to
agree with that.
build networks so that the parts of the community that don't have capacity can build capacity, even while we're doing all this other stuff. So that's the only reason I wanted to make sure I was clear on that piece.
Yeah.
And I would say, just in follow-up to Julie's comment, and I wasn't necessarily, proposing a Wild West solution, but it would be more, if we want to lock everything down into criteria, then you would consider having one that would say collaborative multi-agency proposals must have a lead fiscal agent which qualifies under one of these criteria. Then if you want to build the criteria so there isn't wiggle room, you want to put as many things as you can think of ahead of time into the criteria.
Yeah,
And that would be, I think that would be important, because then people might look for an agency if they're not part of one, or vice versa. And not just say, oh, I don't qualify, so I'm not even gonna try.
Correct. Yeah, that's good. That's good, Julie. That's what we want.
But,
It sounds like, oh, sorry, Linda, go ahead.
well, I was going to say, I think the next page kind of addresses that. So if you look at the schedule that we've come up with, we want to have a grant seekers meeting, and then we also want to have 2 information sessions. So I think that it's on us to make sure from both ends that organizations that maybe don't meet those criteria understand that they should be reaching out to a larger organization that does meet that criteria and try and partner with them, and vice versa. I think what we find a lot is that we have people starting up organizations because they have a good idea, and larger organizations don't always want to take them on. So I think it's important for us to be very, very clear about trying to foster that collaboration and encourage large and small organizations to be talking to each other.
I agree with that.
One
Yes.
question I have,
and I think,
I'm sorry, I was just going to ask where churches fall under this. Does a church fall under a 501c3, Reverend Copeland?
Mhm.
Some have the actual letter, but all have the, for lack of a better word, the designation. In other words, you can apply to get the actual designation letter. Like, for example, our church doesn't, because we're part of a denomination that has
Okay.
that designation. And if you're part of the denomination, you use that mechanism.
Okay. So if you're a church, you're a 501c3, even if you don't have your 501c3 letter from the government, correct?
Correct.
Okay. Okay.
At least those with
Function as.
hierarchy, right?
Say it again.
At least those with a national hierarchy. I mean, there are some churches that are.
Well, definitely those with a national hierarchy. And obviously you have to be registered with the state. I mean, you can't just get
Be a
online.
church.
I got a church. And send me donations. No, you have to actually,
Bring your own snakes or whatever.
Right.
Yeah.
I'm
So
sorry.
I am assuming that, and that maybe is a good example too, that churches could certainly apply it, but a church may be much better to apply with a larger organization
Exactly.
that serves as its fiscal agent. So,
Exactly.
There we go.
And that's the
Well,
whole.
would-
Right.
I have a follow-up question for that. So if they don't have that designation letter, but they're part of an organization that, a hierarchy that does, do they then qualify or do not qualify unless they're with a different organization with the 501c3?
Well,
And
I
then-
think they'd fit in the not-for-profit category regardless of the,
That's true.
right?
Well, just to clarify it, the way we've currently written nonprofit corporations is that they must be registered as a nonprofit in good standing with the state of Illinois and established as a 501c3 under the Internal Revenue Code. So it is, our definition of nonprofit was directly tied to the 501c3 designation.
So back to the scenario you just asked me about, that would mean that those organizations like myself, like ours, that are part of a denomination that has something, fine, the denominational 501c3 letter, that actual official designation letter would cover them. But independent groups, I just started a church, I'm an independent, I don't have anything. They would either have to have their own, and some churches do, apply directly to the IRS for that designation, or they would have to collaborate with somebody who does.
Okay.
And I think we want it that way
Yeah.
because of everything we just described in terms of fiscal responsibility, capacity, and all that kind of stuff.
mhm.
So
Okay,
it sounds like the general consensus was to add a bullet point for hospitals and healthcare systems, including federally qualified health centers, and to otherwise leave these designations as is, noting that this is meant to be for lead organizations on the application. All right.
all right. Moving on to the grant application evaluation rubric.
Actually, Marianne, there's a second page to that. Notice of funding opportunity.
Oh,
So there's a little bit more area that there might be some discussion. So I wanted to show the.
okay, please.
Does everybody have it in front of them? Do you want me to do a
Yeah.
screenshot? of-
I've got, well, maybe people would rather have a screenshot. Want a screenshot?
That'd be good.
Dick would like it.
So on the proposed timeline, can you see this now?
Yes,
I see it.
There was a, most of this was dictated by our original work plan, and I think we're in a position that we can still continue to meet those deadlines, or I shouldn't say deadlines, but those projected targets. January 13th as being the application portal opening. That would be 1 week after the January board meeting, at which time we would hopefully be able to finalize and approve the notice of funding opportunity, strategic plan, and grant application. We could launch a grant seekers meeting that same day. We would have information sessions that would be scheduled so that people would have time to ask questions if they would like. We did understand that that's not a lot of turnaround time to let people know about the grant seekers meeting, but that it could be something that's recorded and published on the YouTube page so that people can watch it.
that's great.
There'd be a 6-week window for applications, which would close on February 24th. There would be a 1-week turnaround time from applications closed to prepare the applications for evaluation, which would then go to board members who are able to evaluate during the month of March, who would then evaluate all and score all of the grant applications and determine recommended funding recommendations to present to the entire board on April 7th, which would, if approved, or if decisions made on April 7th, we were kind of questioning what was a realistic time for the funding cycle. And after some conversations with Reverend Copeland and speaking to the Winnebago County Health Department and their procedures for writing checks, it sounds like what we issue on the Tuesday before the first Thursday of the month gets paid out by the end of the month. So we would not be looking at end of April funding because we'd already be past that deadline when we make our funding decisions, but we'd probably be looking at submitting those for the month of May and having, so our funding cycle would more likely be June 1st through May 30th. And then there would be proposed quarterly reports. So every 3 months, there would be a requirement for the funded organization to report out numbers served and some other key data that would be dictated based on what type of program they're funding or operating.
So that is going to be kind of an intense period of time, especially after the applications open. And then those of us that are going to be involved in reading the grants and scoring I shouldn't say grants, proposals, in scoring them, that would be a month of work for whoever is agreeing to do that. Is that correct? How you understand it, Jason?
Yes, it would be, based on this timeline, and, it's hard to say because we don't know how many applications we'll get, but if we had 40 applications, then, based on this, we would need to have board members who are available and willing to evaluate and score all of those in the month of March. So I think that would probably be a good time right now to consider if there's enough board members that feel like they would have that type of availability before we kind of put this out there.
And what would you say is a good number from this board to agree to doing this? How many do we need?
Linda, were we discussing something around the number of 4 or 5 being a good number for an evaluation committee?
Yeah, I think we thought perhaps 5.
Yeah.
And so are you asking people to actually let you know offline or online, or how do you want to handle this, Jason?
Well, I guess I don't expect everyone to have the answer right now. So maybe you could let me know very quickly so that we can, rework this timeline if there's not going to be board members that have availability in that month. I would say, maybe if people could let me know within a week's time, that would be helpful.
Okay.
For Linda, and Dr. Morris to come back and reevaluate this.
Okay.
And just so there's clarification, Jason and I had talked about, while there would be a review committee that reviews these, we would make the applications available to everyone. I guess I'm throwing this out to see if people want to do this, so that when the recommendations go to the full board, if anyone had, I want to say taken the time, which would be fine. If somebody had taken the time to look at all of the proposals and had a question about why one was not being brought forward for a recommendation, the board would certainly be able, or board members would certainly be able to do that.
Well, thank you for this information. I mean, obviously, I'm hoping we get 5, and I will commit. I mean, I can do that because I feel like I would have the month of March to devote to that for sure.
And I certainly would, I'm open to that. No, we have to do this.
Yeah. So.
I just want to say I appreciate Linda's suggestion that I personally will be looking at March and see, it's such an important role. I'd like to be a part of it, but Linda's suggestion is that we all get all the applications.
Absolutely.
Have the ability to read through them. And then I'm just repeating what you said, as recommendations come forward, we can ask more knowledgeable questions about why something is moving forward or why something is not.
Yeah, and I think as this will become even clearer to those that the expectations as we look at the rubric, because that definitely allows us the criteria on which we're going to be basing scoring and so forth. It's not just going to be a subjective.
Okay.
All right. So any other discussions on this, Jason?
The rest of it, there's just a paragraph about evaluations of proposals and maybe something that everyone would be interested, a comment at the bottom, which McHenry County had in their NOFO that I thought would be important for us, that the board reserves the right to not select a provider or to submit a new notice of funding or redefine services, and also reserves the right to begin negotiations with selected providers for all or part of the proposal components based on its selection criteria. So essentially stating if we were to find that the applications were not of the quality we were expecting or not meeting the goals of the strategic plan, that we could so choose to not fund any of the proposals and say, maybe we messed up the communication of it and need to reissue it, or alternatively that there could be, if there was an excessive number of requests, that some of those could be negotiated to be scaled down to meet the amount of funding that's available.
Okay, thank you very much for this work, Linda and Jason.
Mary Ann,
Mhm.
just one other question, and I think we discussed it before, and I think I remember the answer, but did we have a previous discussion that if all of the funding in a given cycle is not expended, it does or it does not roll over?
It does.
It does. Okay. That's what I thought. Okay. Thank you.
Okay, so
I'm sorry, I didn't hear, Bill. It does or does not what?
it does roll over. The money
Oh, roll over.
yeah.
Okay, thank you.
to the next funding cycle. Mhm.
Yes. Oh, sorry, Marianne, go ahead.
No, now we're on, I brought up the grant evaluation rubric. So here we are.
So, I won't go into granular detail with this. Everyone has a copy of it. If you have questions or you have feedback, please discuss it now or let me know at a future moment. But the gist of it is to break it down into some general categories about the agency itself, the proposal itself, then in terms of what it's proposing to do, the proposal outcomes and its evaluation plan, the budget, and then for future years, this will not be relevant this year, but would be relevant in future funding cycles, but we can at least transparently let people know about it, what we will be evaluating in terms of continued funding in future years based on their performance in a year that they were already funded. And then that basically it's just kind of showing you what that criterion is, and then breaking that down into 3 different categories of substantially compliant, moderately compliant, and minimally compliant, which would be, rated maybe in each of those 6 sub areas or each of those 4 sub areas in the proposal description. So it wouldn't be a terribly complicated evaluation process, but there certainly would be some standards and some different categories that would help score applications. One thing I noted here that maybe we should discuss is, in addition to, evaluating how agencies collaborate, which is part of the evaluation criterion for future year funding. This being copied kind of from another mental health board notes the idea of participating in a council or network that was actually formed by that particular mental health board. So like they meet quarterly and as a group of funded organizations and maybe discuss successes or issues or challenges or things that they're learning. And so, we've never really, I don't know that we've formalized any discussion about that or thought of that as being part of our future work, but I think it's worth mentioning now if we foresee that being part of what we'll do.
Yes. Any comments?
Oh, I have a question. On the rubric, will there be like a points allocated, or are any of these categories weighted higher than the others, or how does this scoring go? Like for substantially compliant, moderately compliant, what if needs to be a tiebreaker or something? Are there points, or is it just really taking a look at which, like you've got 3 out of the 4 and they're substantially, you know what I'm saying?
Yeah.
How do we actually score this other than to say that it's moderately compliant?
Jason, can you answer that?
Sure. One of the thoughts I had was that we could do a scale of 1 to 9 where there's 3 subdivisions within each of these categories. I don't know if that would help delineate them a little bit more. Sometimes if there's too many ranking categories, it can feel like you're losing sight of what that number actually means. When you're in minimally compliant and then you have to break it into 3 subdivisions within that category, it can get a little bit like, how do I really determine, is it a 1 or is it a 2 or is it a 3? Linda, what were your thoughts on that? Because you probably have the most experience in developing grants.
Yeah, Jason and I did have a discussion about this, and Jason, I'm wondering, I don't want to say what we talked about if that's not what if we had kind of turned away from that.
Oh, the 2-tiered system?
Yeah.
I don't think we've turned away from it. I think it's still a very relevant option.
Okay. So Julie, one of the things that we had talked about was exactly that, right? Scoring it. And a couple of years ago, United Way used a grant application and a scoring system so that if you fell within, say, 80% and 100 of what the total score was, you were eligible for a certain level of funding for your proposal. If you fell, so really what we're saying that is if it was really compliant, then the board can decide how much funding to give you based on what the other applications are and things like that, and how it's meeting up with our strategic plan. If it's substantially compliant, we were thinking that you would not necessarily be eligible for 100% of the funding, but you maybe would be eligible for between 50 and 75% of the funding. So what this does, and Jason called it a 2-tier system, is it allows the grant review committee to look at that and score them, and then it allows the entire board to have a little bit more say in exactly how much funding the organization can get. I don't know if my description is clear on that. Sometimes things are clearer on paper, but we were definitely thinking about, yes, a score and a matrix, but then using those scores to determine what level of funding an organization or a collaboration would be eligible for.
That makes sense. So then there would be a matrix of numbers that would go with this.
Right, exactly.
Criterion. Okay.
Right.
Yeah.
Okay.
I think reviewers would appreciate that.
Yeah. Well, and also, as I think it really is an attempt to understand that not everybody is going to have the time to put in to review every single one and look at it really carefully, but we do have a board that is representative of the community, and it shouldn't just be rubber stamping what the grant review committee says. They need to have some authority in deciding some of these grant allocations also.
Yes.
Thank you.
Yes. Thank you very much. Any further discussion or questions on this rubric? Hearing none, I'll move on to the
Sorry,
next agenda item.
Mary Ann,
Oh, I'm sorry.
No.
I
Yes.
had it on mute and I thought it wasn't.
Oh, I'm sorry, Ed.
Go back to Jason had something or asked something about down in the last rubric where it says agency continued funding about the network council piece. Is that something that we wanted to do? And if I understood what you meant by that is that the grant recipients we would have some type of gathering periodically. And again, I didn't quite understand the purpose for that.
I think it's to talk about successes, challenges, to kind of create start to build a network, connecting funded agencies with one another. Also, as people are doing their quarterly evaluations, and maybe some organizations may not have as much capacity as others and may be able to learn from some of the more established organizations about how to do evaluation and things like that. So it kind of become somewhat of a learning network, but also creating a culture of accountability among the funded organizations.
That's
I
why
know McHenry does that. They have a network or a council of the funded agencies, and they do meet on a regular basis. And I do think it's just making each other aware of how the funds are being used and who's having any difficulty or challenges. They can kind of learn so much from each other. So I think it's a fantastic idea.
I agree. And I think it's crucial. I think it's something we definitely should do if that was the question.
I agree too, Ed.
Okay.
All right.
I'll look more into what that might look like.
Okay, and Dr. Gorski, you
Good
have.
question, Marianne. I'm going back and forth between this and our schedule of events under the proposal submission. Are we assuming that once an application is received, that there is no questioning either through Jason or somewhere else of an applicant for clarity around something in an application that is unclear, or is it is what it is? If you've submitted it, I mean, I can see both sides of that to do that sort of thing could create the appearance of perhaps injection of either favoritism or subjectivity into a process by asking a certain applicant to clarify something and not asking others. But so I would just like clarity. If the answer is nope, you've submitted it, typos, whatever, we don't understand exactly what you're saying, that's what it is. Or during that process, we have the latitude to ask someone to clarify.
I will say my experience in applying for grants in all the years, I don't know that I've ever been involved with them calling to ask a specific question. It's, it's almost like, especially state grants and federal grants. I mean, you're scored on what you explain, and if it's not explained well, you're docked points for that. So at the very end, we've always been able to understand why our score was what it was. But during the process, I've never experienced, unless it was something very unusual, like actually, I can't even give you an example, but I'm just basing that on my experience. I'm not saying that's how we should function, but I just know that it does get into people then get the opportunity to maybe an advantage over another applicant. I don't know.
Right. Well, I'm not speaking in favor of it. I'm just speaking for clarity.
No, I agree. I think it's a great discussion point.
I think the other possibility is someone, I'm sorry, Dick, just one last thought. The other possibility is someone submits and during the time frame wants to add something to their submission. Maybe again, anticipating that at the front end, maybe the answer is no.
Dick?
Well, again, Marianne, part of like what you experienced in state grants was after regions were defunct. and we had no opportunity to talk to people. I'm going back
No.
to the 15 years that I had working with agencies and grants, and we did talk with them and we did ask questions, and particularly as we start up with new people and hopefully innovation, I do think we have to do some mentoring.
Oh, yeah, I do believe we should
have
do
to-
that ahead of time, but then after they submit their grants, do you
Yeah.
think each one should be able to call and have a conversation?
Well, we are going to have a conversation with them at some point
Sure.
over their application, and so that could lead us into, a situation where we have multiple conversations with some people while they're developing their piece, So yeah, I'm with Julie in terms of we have to have markers and we have to have some grading, if you will, but at the same time, this is a human service system, and I'm hoping that we get some innovative kinds of things and bring people to it that haven't been there in the past. Just as an example, I would expect, like just Christina's point about there are some parts of the Hispanic service group or even the African American community that they need a hand up, and we should do that, at least in my opinion.
Hey, Linda, you have a comment on?
Yeah, so both United Way and the Community Foundation of Northern Illinois actually do interviews with grant applicants. So they review the applications and then they decide if they're going to bring them in for interviews or not. That's something that we can consider. Again, we're talking time consuming, but it does allow you to get a better idea of what they're doing. It allows you to give them feedback. It allows us, perhaps as reviewers, to see some collaborations and partnerships that could be made because of what we're seeing from the applications. I think, in my mind, the biggest issue that we have is that we need to look 100% neutral, probably 110% neutral. And so that in anything that we do or in this process, we have to think about the perception of somebody out there whose money it is, because it's everybody's money, and how that looks to them. So,
Right.
And the interviews are done like before the submissions. What is the timing of the interview?
and United Way always used to do this, Mary Ann, and actually, and I think
we present.
Right. Remember, and
Yeah.
you would the CEO would have to come in and they would make you bring board members also. So that would be after the applications came in, they were narrowed down. So it wasn't, if 40 came in, you weren't interviewing 40. I know what the Community Foundation, I think what they do now is, I don't know if it's above a certain amount or if they just bring you in because they want to have a conversation with you. I don't know how their interview process works. It used to be when I was there that they would interview everyone also, after they narrowed the grants down. So we can certainly think about that.
Yeah. Wendy.
So in that vein, I know what you talked about was like a June 1 through May 31st funding cycle, but we're going to run into, or whatever it is, we're going to run opposite essentially of what the county funding cycle is, which is October 1 through September 30th, right? And it occurs to me that in our first year, we might want to do sort of a measured process where we do 2/3 of the money, in this established funding cycle, but then we take the next X number of people who are substantially compliant, interview them, and say, we'll have a second round in August. Here are the deficiencies. We have this additional pool of money, and you could resubmit an application or submit a new application based on this conversation we're having with you now. And that might open the door for some new and different players. Just an idea, but to try and give people feedback who haven't maybe had the experience in doing grant applications, so they're not as polished as people who know the ropes.
Bill,
Yeah, I'm processing what Wendy just said. I think Dick's got me thinking more, and Wendy is mentioning it too, about those entities out there who never have gone through something like this. And so they find it daunting and confusing and maybe turned off from even doing it. And I'm wondering, just one other thought. I hate to even mention Jason's name as being, utilizing him continuously as a resource, but you'd wonder if another way would be from the beginning of the announcement of the grant process till the time of submission, Jason, in addition to having an informational meeting, et cetera, is an asset to individuals who may have to call and say they don't quite understand this portion of the criteria. Could you explain it more? Now, I think it was Linda who said, 110%. It has to be, I think, in that situation, it would have to be more process explanation, not quality of application feedback. It would be more, no, this is not exactly what we're looking for. We're looking for these types of things. So anyway, it's just another thought that Jason serves as a resource. The interview thing sure seems wonderful. It also seems daunting, but to me, it raised the question of, for someone who is not funded, would they customarily get feedback as to why, which would give them the feedback to apply in a subsequent cycle?
Yeah, I'm for that. Right. We should have reasons, Bill, for why they get turned down.
I would hope.
Yeah.
Well, I'm in agreement with what has just been said. First of all, what Linda said in terms of the perception, making sure that whatever we do is not only equitable, but it's very clearly seen to be fair and not heavy-handed or anything. But at the same time, I agree with what Dick is saying, and that is, it seems to me we need to use this as an opportunity for building capacity in our community, period.
Right.
Now, what that means in terms of, we don't have an unlimited number of hours between us or resources or whatever, but I believe that based upon what was just even said, some of the ideas like the interview, as well as having a sort of maybe resource line available or process questions or whatever, seems to me that with just a little bit of work, because again, we're not talking about an unlimited number of applicants either. It's not an infinite number
Right.
that are going to apply.
we don't know that yet. We don't know that yet. We could have 100 applicants.
But that's still not infinity.
Well,
If we got 100 applicants, if we got 100 applicants, that's still not infinity. And my point is that it seems to me that the equity piece or the neutrality piece, plus the mentoring or the building capacity piece, is something that we can do. We might not do it perfectly the first round, but I think we need to at least be thinking in those veins.
Julie.
I think on that mentoring piece, or that helping people understand what we're looking for piece, that would be maybe something, and this might be part of the process, but that we should do in advance. Like when the cycle goes out, you hold information meetings. Jason would hold, and maybe a couple other people would hold information meetings for anyone who might be interested in applying. And then at that point, you can talk about, here's what the types of things that we're looking for. This is what this criterion means and what will be scored, and how that will be scored. And then for those of you who are, this is a great opportunity in this meeting to share that we really want collaboration. So if you're here and you just don't really understand, or you're not a big enough entity, how can we get you hooked up with another entity who is large and has that capacity? So I think that doing some of that upfront work kind of addresses those issues of equity and helping people understand what exactly are we looking for in these applications. That would be up front before they even apply. And then they would have, Jason to come back to if they have a question later during the process. But then once they are submitted, then they're submitted. But that way, then they have the opportunity to understand it better before they actually apply. And then the interview, I think that's an awesome idea.
And I fully support that. Yes.
An interview is a great place and a great opportunity then for the team of evaluators to understand clearly what might not be being said as clearly as it could be in the actual application. I think that's kind of what that would help if I were one of those people. So then,
Just for clarity for me about the interview, is that done after some initial process of winnowing out applications down to because if there are 100, it's not possible to interview 100.
No.
So
that's what Linda said, that it would be, once you do that initial weeding out of people who just don't meet the qualifications at all, or it's just not what we're looking for, then that would be the next step, if I understood Linda correctly.
Yeah, that's exactly right. So you may only have 5 interviews.
But you would interview every entity for which you anticipate funding.
Yes.
Yes.
But through the interview, you may decide not to fund them.
Right. The ones who made the first cut. It's like a second round interview.
You could have 10 interviews.
You could have 20.
I mean, it depends.
Yep.
Yeah.
But not infinity.
Not infinity.
Not infinity.
And then you would have to determine the feasibility of an interview process. If you've got 20, you might have to then narrow it down even further.
Right.
So do we want to add more time to the evaluation and the timeline? I mean, it is a tight window to score that many applications in less than 30 days, let alone to then leave open the opportunity for potentially interviewing. Do we need a larger window for that?
Well, this is something else that Jason and I talked about, and I'm sorry, Jason, if you had decided to go in another direction. One of the things that I thought about is, we're having this first round of grants, are we only giving people funding for 4 or 5 months? Because I think that's an issue. So what I had said to Jason is, there any way that to get on the county's fiscal calendar, we can give a grant for 18 months or 15 months, however long the time period is that it makes us, or that it takes us to make these initial decisions and then continue with the following year.
Well, the only thing I would add to that is, and this maybe goes back to Wendy's comment as well, being on the county's calendar, I'm not sure exactly what that would entail. They approve our budget in October, and we're trying to do notice of funding opportunities in January. So to some degree, that really is in alignment with their calendar, because every fiscal year we would know in October how much we're going to be able to award. We'd update our plan accordingly, and then we would issue a notice of funding opportunity for that amount. It just doesn't line up in the sense of the commitments that we make won't be all paid in the same fiscal year for which that budget exists.
And that might be an issue. I don't know if John can chime in on that, but I know, like with the Carrie Lynn Center, our money has to be dispersed consistent with the approved budget by the end of the fiscal year. And
we had the meeting regarding our budget. They said that it would just automatically roll over, because we already know there's probably more money coming in every month right now than we are budgeted for. We only have a total of 9 million, correct, Jason? Wasn't it 9 million?
Yeah, 8.8 for awards.
Yes. So, and they said there would be no problem whatsoever. It would automatically just be in our line, and it can be dispersed in the next cycle. That's my understanding. Jason, you were on the call, and Ed, was that your understanding?
Yes, just based on how the money comes in and everything you've already just described.
So I guess, well, I'm still going to ask the question, are we only making 6 months grant? Are we only are we only fulfilling a grant application for 5 or 6 months? And I don't think an agency is not going to want to put a program in place.
Where are you getting the 5 or 6 months?
Yeah, because it's May to June.
Well, that's my question.
May to June. Like the fall, yeah.
So why are we, okay, so just, I guess I would ask, why don't we extend that to October then? If it's going to be May to June, why don't we extend that to October so that we line up with, do you see what I mean? So that we're spending the money that's allocated to us.
Right.
But in future years, the issue is we'd be awarding grants before we know how much is in our budget.
Right. That's the problem.
Okay.
We're trying to line it up, you know.
We'll know in October. And
so we don't know how much money is available until October.
Or how much is approved for that particular fiscal year to award.
Okay.
It comes in monthly. And we're notified monthly as to how much money, and it's not necessarily the same amount every month.
Okay.
So for example, so this year we're doing, June, but I suppose then over the summer, if we felt confident in what we'd already done, we could have another cycle in the fall, and that second cycle could align if we felt that was necessary.
But
otherwise, it's not necessary.
It would never align, because if you found out in September what your budget is, you're not going to be able to issue funds.
Point. It really, we don't want it to align.
Okay.
I don't think there's any possible way for it to align and for you to have a grant process.
Got it.
We need to know the dollars.
The money continuously rolls. Our cycle then would be June 1st to May 31st every year.
It sounds like it.
Is that correct? And I'm just trying to figure out if that's the assumption.
No, I mean, actually, the next year, our funding cycle would be, I'm assuming we'll know in October what 2022 is going to be. So then we would, our RFPs would be available in January that year. Is that the way you look at that, Jason?
Well, I do think that, I mean, it makes sense to me. I understand we could do an 18-month cycle or something like that, but I would think whatever we establish this first round, that we try to replicate that if we're able to keep a consistency of a cycle.
And the positive part of that is we may have sort of a little stockpile. There may be applicants that need a larger amount of funding in the form of startup funds, as opposed to monthly or quarterly payments. So this way, in January or in June, we're going to have almost a year's worth of cash on hand, correct?
This June?
Yeah.
Well, we'll spend what came in through these months. I mean, we just got our first payment in October.
Right.
So depending on what accumulates, I mean, we have to, we're working off the current budget,
Right. Okay. And we can always adjust this as time goes by.
But we do need to understand that crossing budgetary lines is going to happen. And this is something that we are going to have an understanding with county board members, because you're not going to get agencies to bring on new programs or to start innovative kinds of things within a 4 or 6 month window. They need more time, and they're going to have more time to do the development, and to implement it. So therefore, that's why, that's another one of the reasons why, in my opinion, the interviews become so important, because we need to understand, and the agencies need to understand what we can deliver and what we can't deliver.
Will we entertain multi-year proposals at this point?
I'm hoping so.
Okay.
Well, the current grant application is built for 1 year, and then what applicants can do is they can copy their application over year to year. The grant program would allow for that. So it would allow for the same program to be funded, but it would not be making necessarily multi-year commitments. I mean, we could do that, but that's not what the current draft of the funding notice of funding opportunity is for a 1-year grant cycle.
If that's the way we have to make it work, then we'll make it, we'll do that.
And the reason that McHenry County really recommended that is they got stuck a couple years in the beginning because of the fact that they anticipated more revenue than actually came in. And as a result of that, they were short because they had year grants and then they had new grant applicants. And so it became problematic. So they decided the best way to deal with it is to do it year by year and to know exactly how many dollars they had to distribute.
Mary Ann, I think that
Yes.
I wouldn't disagree at all with a year to year cycle, but based on some experience I've had, I guess I have a bit of a bias about someone being upfront at the beginning if they see a window of time which is multi-year in order to get the maximum results that they're suggesting they can get. I don't know that that
Oh,
should,
I agree.
I don't know that that should be qualifying. I would almost wonder if it should be in the application itself rather than in an interview, because some things may take a longer time to percolate.
Yes.
And I think the situation we wouldn't want to get in is, I think you'd want to be very careful about funding something for a year and then it simply doesn't turn out. And they come back a second year and the choice is to not fund the second year without having, adequate documentation. It could be public relations wise, it could be difficult, and it could be for the services, it could be difficult to have gone down that path. So
yeah, and also for any clients participating in
Yes.
something, to cut them off.
But
So
just
I
like
agree with that. I think we need to think about that possibility, because any pilot program or any program takes months to get off the ground and to prove, we're trying to prove in 6 years how impactful this revenue is going to be in the community. But if they gave us a year, that would look where we'd be. It's hard to do something that quickly. So I agree. The only thing that I think we have to really be, when these proposals go out, sustainability, the organization has to begin thinking about that in their application. It's got to be how would you long-term sustain this without the funding from, the mental health board.
absolutely.
So I think that's got to be in there too. So anyhow, any other comments about this or concerns? Any decisions that we, Jason, is there any clarification you need from the board in terms of changes for the proposals or anything?
Well, I guess I would just ask the question, are we ready to launch a grant application in January based on today's conversation? I know we have time to prepare it. But we'll, once it's live, we can certainly make changes on the fly, but it's kind of harder to do that when you have people spending their time writing applications and then you're, changing deadlines and things like that. So I think it's best that we feel really comfortable with it up front before we release it. And so it sounds like there are some outstanding questions that have not been resolved in today's conversation that certainly, I can make suggestions, I can research what other people are doing, but to a certain degree have done that, and that still might not fit what we want to do. So I think we have to ultimately have some resolution around that. Also, I would note that this is year one of multiple years, and we can learn from the process this year, and we can update it and make it better next year. We don't have to have it in a perfect version the first year through.
Yeah, I've been just listening to all the comments, and I agree with you. I think that this discussion is needed, and we have to, we could go on about this even at the next board meeting. But I think we have to come to the agreement that we are comfortable enough with what we have initiated and launch this, and we can definitely improve upon it. But the only thing we cannot do is, and I think this was brought up too, we have to be certain enough of this that we can remain neutral and give the same criterion information to any applicant and help in the best way that we know how. But I think we really and truly have so much already that has been developed here. And I would hate to put it off another month when in fact the community is, I really don't know how many applicants are out there. I gave the number just because that there is a possibility. But when you think of, the proposals and what our focuses are going to be, which we've got to get to quickly or we're never going to get there. There really isn't going to be as much debate about all of this because there are going to be definite focuses that we've resolved because of all of the data gathering that's taken place and all of the work that Jason has done. It's pretty remarkable. So I'm not going to say much more. I want to get to it. But are we comfortable enough to move ahead is the question of the hour. Or do you want to spend more time? This has got to be a comfortable kind of process for everyone on the board.
I'm comfortable with, I think today's discussion was really good just to clarify what we already have written down. I'm not hearing that there's a lot of dissent. I think it's just trying to work through so we all understand
right
what the verbiage is. I feel like we're in a great place. From my
if we're comfortable, we can move ahead. But
I agree. I think we should move forward because, an imperfect plan is better than a non-existent one. If we can make adjustments as we see moving forward, and the insights that were brought forward today, I thought were very crucial, and
absolutely,
we definitely need to resolve them. But at the same time, if money is being allocated and given the need in the community, I think whatever little we can do is better than what is being done right now, and we can work out the rest as we move forward.
I agree. Anybody else want to comment before we? I don't know that we're voting on this. I think it's just.
Well, but is it legitimate that we could just simply, make a, how many on the board feel that they would like to feel comfortable enough with the proposed definitions to move toward putting out our request for proposals? Okay. All right.
Yeah. So I think we're moving ahead. It looks like enough hands went up.
January, and again, it's not finalized until the board approves it in January. So there's at
Right.
that.
Right.
If people aren't feeling comfortable with what we have, then we
Yeah.
can adjust, but.
Right.
let's shoot
Good.
For that goal.
Okay.
I agree. And then what we need to do is just the next agenda item is the affiliation and disqualifications. What Jason did took a lot of time in his part is to talk, or people sent in any organization they were on the board of or employed by, and automatically those organizations are disqualified for this round of funding. Doesn't mean, that adjustments cannot be made. I withdrew from the Gary Lynn board because I know it's a 501c3, but nevertheless, it is a board, and I did not want them to feel as if they could not apply for funding. So I did resign from that board. But that's really up to, and you have to think about it, that the funding cycle is going to be pretty immediate after the proposal goes out. So generally speaking, I have a very good idea that many organizations already know in their mind if they're going to be applying, because they know they've been watching the calendar and they've been watching what they read in the paper about our time frames. So I think that we can feel satisfied that, we have time if we are on boards, that we, if someone wants to apply, then, we have a decision to make it's a personal decision, whether or not you resign. So that's all I want to say about that. And the organizations that are disqualified, correct?
Yeah, that was the interpretation I think the board had of the bylaws that we discussed last time. And so, again, that's in a draft form right now. So we have until the time that we actually launch the notice of funding opportunity to finalize that. So certainly you need to have conversations with organizations about maybe what their intentions might be, and as Mary Ann did, step down from board because of that, then there's time to do that still.
Yeah. Okay, and then to leave just a few minutes for the most important part, Jason is going to share with us public participation survey results.
Yeah, I'll try to be pretty brief with this. The gist of the kind of results were that we had great response in overall numbers in terms of, we had 693 people respond to the survey. We had 233 actual completions, which was a 34% completion rate. 1/3 of the total applicants or people that responded to the survey did not go past question number 2. There were a couple of people that noted issues with trying to complete it in Facebook, that after the second question, it took them to Facebook Messenger. So we did, let people know, here's a link that you can copy into your web browser and do it. So it's possible some of those people that were an incomplete there ended up going into their web browser and completing it. And so we don't know all the reasons why. Certainly some people presented their feedback. There were a couple people that thought the survey was maybe too long, but a lot of people's feedback when asked how much time it actually took was between 10 and 15 minutes. And so while it could have been shorter, I think we would have lost a lot of the content by making it too much shorter. And we did get a lot of great response, and both quantitative and qualitatively. So let me just present to you a kind of overview of what people deemed as being a priority. So If you see this sheet here, I've kind of summarized responses that were completed surveys from residents of Winnebago County. There's a total of 218 of the total respondents, and broke them down by differences in perspective. And what this chart here is showing you are the percentage of those folks that ranked a particular service area as either priority or high priority. And then you'll see an average of that particular subgroup based on, so like, for example, this one here is showing the breakdown between the lived experience perspective, which includes people who live with mental illness or substance abuse, or who are a family member of someone who lives with substance abuse or mental illness. We have the provider perspective here, so either top-level administrators or direct frontline staff that work with clients, and then the resident perspective. So that was the community member perspective who did not identify as having lived experience or being a provider. And so the colors here, to make it kind of easy to quickly see patterns and trends, is that the light green color shows an above average response. So they ranked that area above what was average for that particular group's general ranking of things as priority. The darker green shows that that response was really high and that it was one standard deviation above the mean. So it's showing that those are really the highest priority items for that particular group who's ranking. And the same then with this kind of orangish red color is the reverse of that, which the light red or light orange color is below average, and the darker orange color is one standard deviation below the mean, which would show that those were really the lowest priority items ranked by that particular group. What's interesting here, to me at least, is that there's actually, breaking it down by perspective, race and ethnicity, education, age, and gender, unequivocally, the mental health treatment focus area, which includes diagnostic evaluation, supportive counseling, medication management, and substance abuse services, was clearly ranked, very highly by almost every group. So we see that dark green color, which shows that that was really ranked among the highest in almost every subgroup, and overall in aggregate ended up with 4 of the top 5 service areas overall. So that really stood out. The other area that stands out, you'll see, is crisis walk-in services. As you kind of go across that one, you'll see it ranked really highly by almost every subgroup and ended up number 3 overall in aggregate rank. And crisis services in general, crisis response services, were particularly high. In general, you see a lot of green there. The one that kind of ranked the lowest of those 4 was the crisis telephone services. But as you look at that one, that's an interesting one because the perspective from lived experience versus provider and resident experience was a little different in that one. Actually, lived experience perspective rated it above average. And similarly with some of the groupings that had lower response, we see that they ranked this a little bit higher. So the non-white population ranked it higher than the white population. Those who do not have a 4-year degree or more ranked it higher than the bachelor's degree and graduate degree subgroups, and males ranked it higher than females. And all of those groups that I mentioned, non-white, no 4-year degree, and male, were some of the groupings that had lower response rates overall. So that particular one in aggregate is a little bit skewed by the fact that the subgroups that were filled out more surveys ranked that lower than some of the other groupings. So that's one that might still be for consideration of of a high priority status, even though it didn't in aggregate score as high as some of the other ones. I'm going to note also the case management. You see green across the entire row there. So that means, again, every perspective, every group ranked that pretty highly above average, and an overall rank, it ended up number 6. And then here with family and community support, that was another one that showed up ranking pretty high. A couple of orange spots here and there, but mostly green, and total rank on aggregate ended up 8th overall for assistance to families and 10th overall for education to community. So I won't go into like specific detail of every single area, but I think it does really help us to start to see what the community's perspective was of the highest priority areas. The other thing I will note is that you don't see here the ranks for services that were rated as important, but I think overall the community found that every one of these service areas was very important and or a high priority. So I think it just reaffirms the importance of the community support system framework overall, that there was no particular area that the community response came back as saying this is not an important service in our community. All of them were considered highly important. I think the highest ranking category for non-important was maybe like 5 or 6% overall of non-importance, and everything else was a fraction of that.
This is phenomenal work. I mean, it just redefines the focus. It narrows in on the priorities so well. And I thank you for doing this, Jason. It's really
Nice
I'm
job.
just so impressed
Nice
with
job.
it.
Yeah.
All right, very good. Well, all of you have been sent copies of this, and certainly we'll be doing a little bit more analysis of then the next level breakdowns where people started to report what were the specific types of improvements that they would want to see in these different service areas. So that will, in terms of first identifying priority areas for the strategic plan, then getting to the target populations, client unit, and then ultimately, what are those intended outcomes? What are the actual improvements that we want to see in each of these areas? And I think the rest of the survey responses will be really important for that particular part of it.
Any comments, questions?
One of the comments I saw over and over again in just the notes was people saying better services delivered closer to home kinds of things, and also faster and broader service availability, more providers, and people said over and over again, we need services when we're in crisis, not 6 weeks from now.
Right, exactly.
And they were explicit in that. So I think that has to be one of our major, whether it's in evaluation or drugs and alcohol, I think those really have to be our top priorities. And expanding those.
Okay.
So my goal would be to have a draft plan out by like December 18th for everyone to review, because I don't want to just present that 3 days before the meeting. I know there's going to be a lot of content. There's going to be people are going to want to weigh in on that and have questions. So I'll try to have something to you by then, so we have a couple weeks in advance of our next meeting to make comments, make changes, and hopefully be able to bring that for approval in January.
Okay. All right. Any other questions or concerns? If not, the next agenda item is other matters. I have nothing, but Jason, do you have anything under other matters?
I don't have anything. Terry, did you
Yeah.
put you on the spot?
Yeah, something on the side here, and I'll try to be quick with it. At the last meeting, somebody said, hey, it would be great if we had sweatshirts. Well, I took you up on that. And actually, you know, my last name ends in a vowel. I know a guy. So I gave a call to a friend of mine, and he can do it. It's if we want to do the logo, if we want sweatshirts or whatever the case may be, he can do it. But we need, and I gave Jason all the information on it so we can go from there. So if you really want it, you can say with our little logo and mentally fit in 815.
Yeah.
Make great stocking stuffers.
Yeah, and I just wanted to comment on Danielle and Ed's PSAs. I thought they were terrific. And thank you for doing them.
Yeah, a lot of good stuff coming out of that.
So just to clarify, I don't believe Terry, we had conversation about this, and this is not being suggested as a board expense, but something if you're independently interested and
Right.
want to pay for yourself. So if you are interested in that and you would like to email me, I can certainly forward that information to Terry so that he is aware of any interest there is and that he could place an
We need
order.
at least, yeah, we need at least 12, and we're missing Tim, so he makes a baker's dozen. So that'll work.
Okay. Well, if there's no other matters, I will ask.
I'd like to move for adjournment.
Oh, Dick, you do that every time. And I need a second.
I'll
Second.
All those in favor, say aye.
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 Opposed, same sign. I want to wish everyone a wonderful holiday season. Yeah.
Oh, you too.
You too.
Very
Thank you,
good.
Mary
Vaccine will be here and we can be normal on the other.
Right.
Ann.
Yeah,
Be
Great
nice.
group. Great group.
Oh,
Thank you so much.